All right, so we're going to move on to talk about lighting now. Lighting preference varies from person to person, even if they have the same eye condition. So don't just assume that everybody with macular degeneration likes one particular style of light, for example. It's individual. When you're providing lighting for your patient, you must be aware of glare because increasing lighting also potentially increases glare. So you need to try and avoid glare for your patients. Glare is caused by light scatter within the eye. So light from one object affects the ability to see another object. For example, bright light or reflection from a window onto a TV screen is an example of that type of lighting issue. So how do we minimize glare? Well, we can use a directional light that has a shade and ensure that the light is coming from the side. So if you have a look at the picture here, you can see that light is on a stand, it's got a shade, it's pointing directionally down onto the book that the patient is wanting to read, and you can see the bright spot of light which is right on the book. It's not in her eyes. It's not, that shade is tilted slightly away from her eyes so that she's not getting the glare from there. Okay, so now we're going to talk about lighting assessment and evaluating lighting in the patient's living environment. So as I said before, it's really important to be able to go out into the patient's own home if you can, just to see what the illumination is like. If you carry a light meter with you, that can also provide information about illumination and how bright things are. And there are actually Australian standards in terms of what the amount of lighting needs to be, say, in an office space where people are doing near work, for example, or along corridors in nursing homes and so on. So you can carry your light meter with you and the list of Australian standards and just check that the areas comply. Now, you can't really do too much about it apart from suggesting modifications to your patient in their own home, but certainly if you find issues in supported accommodation, you can inform the management there to improve the lighting. And that won't just benefit the vision impaired patients, but will generally benefit all the patients there. Because as we age, we're going to need more light anyway. So with the light meter, you can essentially document whether there's sufficient lighting and also, as I said, justify the need for improvement. You should also observe your patient performing tasks such as reading or writing or activities of daily living in their own home or wherever they happen to be and spend a lot of time. So compare it with and without lighting and show them what it looks like with and without lighting. That's crucial. All right, so let's have a look at the type of lights available. And the first one is daylight. Now, this is the most natural sort of light and is appropriate for most tasks. But you can sometimes have inconsistencies and it can be glary and create shadows. But you will hear a lot of your patients say that they, on a nice day, like to go and sit outside in the sun because they get a lot of bright light, which is terrific. You can also get incandescent lights, and there's an image of those shown there. They come in a variety of wattages, and they're a good source of concentrated light. They're very good for spot reading and near tasks, and incandescent light doesn't flicker. Unfortunately, it's not very much recommended for general room lighting because incandescent lights can be quite dull, and they can create both shadows and glare. Another thing is now that they get hot, so as you increase the wattage, the heat is increased. You'll find that these sort of incandescent lights are being replaced now by the energy saver lights, which are less hot, but the other issues with them still stand. They can give you shadows and often not be too bright. So if a patient's got one of these just in the ceiling of their kitchen, it's definitely not going to be enough lighting. Then they're going to need to make modification if they have issues with not having enough light. Here's a fluorescent light. Daylight fluorescent globes are quite good for general room lighting. They will illuminate a larger area than incandescent lights, and they actually don't create shadows, and they're very, very good. They also are cooler in temperature, and the problem is that they can flicker and they can become unstable. You also can't dim them if the patient's got issues with glare. Halogen lights are brighter than incandescent lights, and they allow more illumination with a lower wattage, and therefore they're more energy efficient. And you'll find some patients are very conscious of being energy efficient. One of the big issues with these is that they do get hot, and this can be a particular hazard for patients with vision impairment. They're also very bright, so you'll need to use these in a shade like a lamp, and they will cause shadows, so they might be quite hard for patients with, if they're using them for prolonged work. Patients will often complain that they're glary as well, especially if they're used in ceilings. All right, so what type of light do you suggest to your patient? Well, I'm giving you a reference there by Apogee and co. And this group of researchers investigated reading performance with various lamps in patients with macular degeneration. And the researchers agree that people with vision loss due to macular degeneration show improvement in visual function with optimum levels of lighting, because what happens is both visual acuity and contrast will improve. The clinical experience shows that low vision clinics have several types of lamps available to demonstrate to their patients, and patients will often ask you which lamp is best for home use. Now, remember these key findings when you're working in not just a low vision setting, but even in an ophthalmic clinic, because this will be very useful. Patients will ask you this information all the time. So the purpose of Apogee's study was to determine if there was an objective difference in reading performance in these patients with AMD, and they used 4 commonly available lamps with varying spectral radiance. So they used a standard incandescent light, which was clear. They used a daylight or blue incandescent. I showed you a picture of that before. A compact cool white fluorescent, that was in the pictures as well. And of course a halogen, which is the most recent picture that I showed you. The reason that the researchers chose to study patients with macular degeneration only for this study is because it's the most common cause of vision impairment. And also, research suggests that patients with AMD benefit from task lighting. And so the researchers were interested to find out if there was a relationship between spectral radiance and retinal scatter. The findings indicated that there were no significant interactions between the type of macular degeneration and spectral radiance, meaning what type of light, for any measures of reading performance. There was no difference between the lamps and no difference on any other outcome measures. So the authors concluded that the spectral radiance of localized light sources is not an important factor when deciding on the lamp type to use for reading. What does that mean in essence? What it means is that lighting is important, and patients with eye disease and vision impairment should definitely have increased lighting. The type of light actually and the type of globe is less important. They should just improve the amount of light and select something that they have a preference for. Okay, next I'm going to move on to explain to you how to modify contrast. So if your patient has contrast problems, and I would be very surprised if your patient with low vision didn't have a contrast problem, you can actually help them by teaching them to increase the contrast of objects that they're looking at. So for example, here's two pictures side by side of some little baby Roma tomatoes that I've taken a picture of. On the left-hand side, they're on a kitchen chopping board that's red. And you'll see that the difference between the background, the chopping board, and the tomatoes is not all that great. So imagine someone with vision impairment trying to see the tomatoes on that chopping board. It would be quite difficult. On the right-hand side, though, you'll see that the tomatoes are on a yellow chopping board, and you can see naturally how I have modified the contrast between the object, the tomato, and the background being the chopping board. And that's really important to explain those tips and tricks to your patient because they will be able to modify their environment often themselves. So for example, don't chop an onion on a white chopping board or a brown chopping board. You might want to use a blue one or something. And you can actually buy this pack of chopping boards that I have here. They come in red, yellow, green and blue. And they're quite useful because they'll cover a variety of different vegetables that way and food groups. Here's another image showing a very similar thing, and it's a banana. This time on a yellow chopping board or yellow background, and then on the right hand side you'll see that it's on the blue background. And it's much, much easier to actually see the banana against the blue background. And so what I've naturally done without really doing anything too much is I've modified the contrast of this particular object. Alright, so that pretty much wraps up the information relating to modifying the environment, and hopefully this has given you some more insight into this area.